meaning of definition of open access. Open access publishing means free online access to research. It means research articles are available online for free. And second one, no paywalls or subscription fees. It means anyone can read, download, and share the research paper without paying money or needing a subscription. And open access promote free reading, downloading, sharing, and reuse the research paper. But we can reuse the research paper after giving the credit to the original author. Fourth one, encourage innovation and collaboration. It means researcher can build on each other's work. Next one, cost-effective publishing. In this, readers doesn't have to pay any money to read the research paper and to use the research paper. And last one, help meet funding mandates. For example, there are some government-funded research paper. Means in government-funded research paper, we can publish our research paper openly. Means we can publish our research paper freely. Now it's a type of open access. There are five types of open access publishing. First one is a gold open access. Second one, green open access. Diamond open access. Hybrid open access. And last one is a black open access. Black open access is not a category of open access, but for some reading point of view, we can do the black open access. Means what is the meaning of black open access? Now first one is the gold open access publishing. In gold open access publishing, first one is that the final article is freely available on the journal website. And second one, the author has to pay the APS, article processing charges. Means if you want to publish your paper in open access, in gold open access, the author has to pay some APC. APC is like article processing charges. And you can convert your subscription journal into open access. It is called the hybrid open access publishing. And in this, we have to do the APC payment, article processing charges we have to pay. There are some advantage of hybrid open access publishing. Easy compliance with open access mandate, and there are high quality peer review. Hybrid open access publishing, there are some research paper, there are very good high quality peer reviews in that research paper. But there are some disadvantage in hybrid open access publishing. First one is expensive. The APC charges of hybrid open access publishing is higher as compared to gold open access. Second one is a mixed access level, because it is a mixed because there are two type of open access are there. First one is a gold open access, and second one is a subscription open access. Means two access are there. Okay, first one in a same journal, one paper is open access and one paper is subscription based, so that it is mixed. And last one is does not fully shift to open access. Does not fully shift to open access. In this, we are not a fully open access, not a full subscription base. It is a both mixed of it. And last one is black open access publishing. In black open access publishing, in this illegal sharing of article, and articles are not openly licensed. For example, Sci-Hub, and in Sci-Hub we can download any paper, but it is not ethical or it is not legal to download the paper in that one, in black open access publishing. And after 2020, if any articles are there in black open access, then you can't download that article in black open access, because after the Supreme Court order, after the 2020 articles are not available in black open access. And there are some process. Obvious, first we have to do the research. After the manuscript prepared,
okay,
journal
Karishma, we
submission,
have gone through, sorry for interruption. We have gone through the presentation. You just show me the first slide, please.
Okay, sir. Thank you. Just 1 minute, sir.
I scroll above. Okay, the whole format is fine. It's Times New Roman with the uniformity of the font and font style. Thank you so much. And the format is all correct. Just the presentation orientation has to be polished, and with time it will be done. So thank you so much. The next presentation is by, please share your screen. I'm just telling the name. It's Deepika. Deepika, if you are there in the meeting, kindly share your screen.
Good morning,
Otherwise,
sir. Yes, sir, I'm there in the meeting. I'm
okay,
sharing my screen.
Sure. Please keep the time limit within 5 minutes, everyone, because there are pretty much of people who want to present. If few people will be left, they'll carry forward to another week or the next week. Yes, please proceed. We can see your screen. Proceed, please.
Good morning to everyone present here, respected sir and all the members present in the class today. So today I am presenting crisis and its intervention. So myself Deepika Kumari, I am from October batch nursing. So before going towards the crisis, we need to know what exactly crisis is and how it takes place. So stress, I think all of us are aware about stress, but not very much clear. So stress are of two types. We are having eustress and distress. So actually, how we respond to any stimuli or any situation is called as stress. It is a non-specific response which our body made up makes. So if we respond positively, that means if because of stressful situation we are working hard, then it is called as eustress. And if we are working, if we are getting sad and if we are getting depressed, then it is called as distress. So the situations because of which we are getting stressed, these are called as stressors. Stressors are of various types. These can be environmental stressors, physiological stressors, social stressors, and the thoughts which we are having. Environment like weather change, because of high temperature, I think all of us are aware, जैसे बहुत when we get hot enough we get irritated and we feel that why we are working so hard. Physiological, if you are having any health issues, if you are having fever, will you be able to maintain concentration? No. Social stressor, the financial issues can be there, and the negative thought process, no, I'm fat, oh, why everything goes wrong with me only. So these are various situations because of which we have stress. And these stress, when it gets exaggerated, it gets overwhelmed, then develops crisis. Crisis is that turning point in any individual's life that produces an overwhelming emotional response. It results in disequilibrium, because of which individual is unable to recover. And one definition is also given by Taylor, that crises of are an individual or family's coping mechanisms that which are inadequate to meet the demands of any situation, and these are combined with individual or family perception of the meaning of the event. So how we can characterize crisis? Crisis occurs in one individual at one time or another. So all of us face stressors in our lifestyle. All of us have stress, but how we are reacting depends on us. So these crises takes place in our lifestyle, but how we are reacting to it depends on us. These are precipitated, increased by certain identifiable events which we normally face in situation. These are personal by nature, so each and every individual have personal response. They are very much personal. Normally they are acute, not chronic, and can be resolved, but we need the treatment and the intervention. So it have the uh, potential that it can lead to psychological growth or deterioration. That means it can go lead to an individual to into depression or any psychiatric issues. Further, going towards what are the factors that are leading crisis, how we are perceiving the event. If there is hot weather, how we are reacting, how we are perceiving that, uh, how our reaction is taking place towards that temperature. Our situational support, if we are having friends and family to talk with, then there are chances of having crisis and stress, distress in our life is low. How we are able to cope with a situation, many a times we usually ignore the situation or just settle it down. It should not take place. There are certain types of crisis. These are maturational crisis. See, I already said that each and every one of us face the crisis situation. Maturational crisis takes place when we go into different stages of our life, from child to adolescence to adulthood, then elderly. We face situations, we face challenges in our life. These are the maturational crises. Situational crisis, for example, any disastrous event, fire or bomb threat, these are the situational crises. Social crisis, like your financial need. Certain sign and symptoms for by which you can identify crisis are anxiety, that is the burden of free flow anxiety. You feel anxious maximum of time, then it is a sign of crisis. Becoming irrational, blaming others for your failures or your issues is again a sign. And going into depression, anger or guilt, these are the final sign and symptoms of crisis, which leads to unhealthy mechanisms, and it's difficult for getting coped up with this situation. Crisis interventions that we usually use, the goals: we need to immediately resolve the crisis, we need to focus on the supportive groups at the pre-crisis level. A therapist role is also important. It plays a direct supportive in with an active participation. Certain aims of crisis intervention: to correct the cognitive perception, that is the negative thought process, that the thought we are having, I'm fat or I'm tall, I'm short, these are the negative thought process. So we need to correct that cognition, and to assist the individual in managing the intense and overwhelming feelings. So these are certain techniques we use to uh, 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 we use in crisis. These are the interventional techniques. Catharsis is saying about the situation. So we talk with the clients having going into crisis or in depression, and they talk about themselves, they talk about the situations which if are affecting them, clarification of that situation, manipulation of the events. We change the environmental setting so that we can help them to get better and treated. We reinforce the behavior, that is the positive behavior is reinforced. Support of defense mechanisms is focused. We helps them to increase their self esteem. Maximum times we used to have clients with low self respect, having a negative thought process. So at that time we need to increase self esteem of our clients. Further exploration of solutions is done in crisis intervention. So certain principles that we used to follow
Okay, Deepika,
crisis
it's
intervention.
already 10 minutes now. You can just
Okay,
move
sir.
forward with the slide so that I can see the
Okay,
furthest.
sir. It's over, sir.
Oh,
Thank you.
okay, it's already over. Okay, thank
Yes,
you so
sir.
much.
Okay,
So,
sir.
with the other participants, I am saying just keep 5 minutes limit because there are too many participants to who want to present. So, overall, Deepika, it was a very nice presentation and a nice topic, and I can see a uniformity in the whole presentation. Thank you so much. It will help you really in the further progression of the PhD. So, after
Thank you
that,
so much, sir.
Ashu from CSC or chemistry, okay, chemistry department. If the person is here, they can share their screen, please. Otherwise, Sheena Sahadevan, nursing. Is the Tashu in the meeting? Sorry, is Tashu in the meeting? There is no reply. After that, Seena Sahadevan.
Sir, good morning, sir.
Yes, you can share your screen because Tashu, I don't think so. He's or the person is there in the meeting.
Sir, I'm sorry, sir. I got an emergency right now in the hospital. So
Okay.
there's, I'm sorry, sir. Shall I present on the next day, sir? Next class, sir?
Okay, you please carry forward to the next Saturday or Sunday whenever you will get the time. We
I'm
actually
sorry,
cannot ignore the emergencies. So, but
sir.
that they should be the genuine one. It's a request from everyone. So after that, Iram Qureshi. Sapna, you have raised the hand. You want to say something?
Yes, sir. I have one query. Ma'am has used a very interactive PPT, like lots and lots of pictures were there. So, can we use these pictures at the time of our presentations, like the coursework and everything?
Sorry, what you are talking about?
Like the use of pictures in our presentation, is it okay? In the coursework also, like when we present our presentation in the classes, and like, so is it okay?
See, there are two types of presentations. If you are teaching someone, then the pictures which are animation based, they
Mm-hmm.
are okay to use. But if you are presenting your research work, in that
Mm-hmm.
it has to be only the pictures related to your research, and that too it should be named that this is the figure with a complete genuine legend, and it should be quoted somewhere in the text, or it should be
Mm-hmm.
published somewhere by you, or something
Mm-hmm.
like that. But that has to be the research PPT or the progress PPTs which you do so. But if you are
Okay.
using the PPTs for teaching purpose, then it
Mm-hmm.
can be informal.
Got
But
it.
in the research presentation, in your synopsis or the final presentations, please do not apply any animative figures or anything which is just not related to your research work executed in the laboratory or on the computer or on the patients which you have done. Please
Got
do
it.
not use that.
Got it. Thank you so much.
Okay.
Okay. Okay.
Okay, sure. So Iram is also not there. I think Jeeban Lata has Jeeban Lata.
Yes, sir. Yes, sir. Good morning, sir. I'm
You
sharing the
can share
screen.
your screen if you want to present.
Okay, sir. Thank you. Hello, sir.
Yes, we can see your screen and also you are audible. Please carry on with the presentation.
Okay, sir. Good morning, respected sir and my dear fellow mates. Today I'm going to present my paper. So, the background of the study, Dr. Carl G. Jung proposes to classify the individuals into two main groups, that is extroverts and introverts. So the statement of the problem which we have taken was a comparative study to assess the level of stress and coping strategies among the introvert and extrovert nursing students in selected college of nursing uh, in Delhi and NCR. The objectives of the study were to identify the introvert and extrovert personality trait among the nursing students in selected college of nursing Delhi and NCR. Objectives 2 was to assess the level of stress and coping strategies among introvert and extrovert nursing students. Third objective was to compare the level of stress and coping strategies among introvert and extrovert nursing students. Fourth objective was to determine the relationship between stress and coping strategies among introvert and extrovert nursing students. The fifth objective was to determine the association between the stress and coping strategies with the selected demographic variables. The hypothesis which we made for this study was the first hypothesis was there will be a significant mean difference between the level of stress among the introvert and extrovert nursing students at 0.05 level of significance. Second hypothesis was there will be a significant mean difference between the coping strategies adopted by the introvert and extrovert nursing students at 0.05 level of significance. Third was there will be a significant relationship between the level of stress and coping strategies among introvert nursing students at 0.05 level of significance. Fourth hypothesis was there will be there will be significant relationship between the level of stress and coping strategies among extrovert nursing students at 0.05 level of significance. Null hypothesis we made were there will be no significant mean difference between the level of stress among the introvert and extrovert nursing students at 0.05 level of significance. Second null hypothesis, there will be no significant mean difference between the coping strategies adopted by introvert and extrovert nursing students at 0.05 level of significance. Third null hypothesis was there will be no significant relationship between the level of stress and coping strategies among introvert nursing students at 0.05 level of significance. And fourth was there will be no significant relationship between the level of stress and coping strategies among the extrovert nursing students at 0.05 level of significance. Assumptions were the nursing students may experience significant level of stress. The nursing students may adopt various coping strategies to overcome the stress. The coping strategies adopted by the introvert and extrovert nursing students may vary. The operation definitions which we used for this study were stress. In this study, stress refers to the level of physiological and psychological tension that threatens the psychological equilibrium that is assessed with the help of perceived stress scale. So this was the standardized scale which we use. Coping strategies. In this study, coping strategies refers to the psychological and behavioral efforts used by the nursing students to manage the stress that is assessed with the help of brief COPE inventory. This is also a standardized scale. Introvert. In this study, introverts are those who are interested in one's own feelings, emotions, and reactions that is assessed with the help of modified questionnaire based on Eisenberg personality questionnaire. Extrovert. In the study, extroverts are those who are oriented to one's interest and energized towards the outer world of the people and things that is assessed with the help of modified questionnaire based on Eisenberg personalities questionnaire. Nursing students. In the study, nursing students refers to those students who are enrolled in BSc nursing, post-basic and post-basic and GNM, general nursing and midwifery of the selected colleges in Delhi and NCR. So the delimitations of the study were nursing students of the College of Nursing in Delhi and NCR only, and students who can read and write English and Hindi. So the conceptual framework we used was based on the Lazarus stress and coping model, through which we have the input, process, output, and the feedback. So in the input, there are two inputs. Like for example, it is perceptual signal, and the second one is the personal factors. So in the perceptual signal, that is like the perception of the stress among the introvert and the extrovert students. So the stress which is perceived by the introvert and the extrovert nursing students. And the personal factors like the age, gender, type of the family income, number of
Okay,
siblings,
Jeevan
and
Lata, can you show me the presentation further in these slides? How
okay
many
sir.
slides are there?
Okay sir,
We
sure.
have research
Yeah,
methodology, then we have
yeah, yes.
variables, and
Sir,
after
so
that we
this
have
is
a
the
flow chart.
schematic diagram
Yes,
of
yes,
the
I understand that.
methodology. So the
Okay, and
description of the tools,
okay, ethical consideration.
yeah, then the data
Furthermore,
analysis. So the tables, when I was doing it, said it was not properly
okay,
coming on the PPT.
okay, okay.
So table 1, frequency and percentage distribution of the
Yes,
demographic
yes, yeah.
variables.
You move further,
Yeah.
move further.
Table 2,
That's
finding.
pretty much of a slides.
Yeah,
So
sir.
only one thing, the slides are completely in the scientific manner. They are
Okay.
perfect for the scientific presentation with the
Okay, sir.
genuine pictures which have to be there. The only thing is if the time limit has to be framed, has been framed, that will be framed in the further PPTs of your department or somewhere else, maybe in the conference. So you have to manage the number of PPTs according to that. You don't have to show all the results. You just have to conclude in
Okay,
five
sir.
6 points. Okay,
Okay,
otherwise
sir.
there will always be a problem that for the half of the time you have just explained the your work, but you will not
Yes,
be
sir.
able to show the result. So just try to frame all these things into a scientific time limit manner. Rest
Okay, sir.
everything is fine. Thank you.
Okay, thank you, sir.
The next person to show is it Mr. Rakesh? Mr. Rakesh Kumar? If the person is not there in the meeting, we'll move forward with Aditi, MGMT 25B26. Is Miss Aditi over here in the presentation? Okay, moving forward with Neha Patyal. Neha, are you there in the class? Okay, Neha, please move forward with your presentation. Just do not forget to unmute your mic because we can see the screen but we cannot hear you. We can see your screen, Neha, but you are not audible to me. Or if someone else is there in the presentation to whom she is audible, maybe there is something problem in the device or with the mic. Because to me, you are not audible. But we can see your screen. I mean, I can see your screen. Very less voices being audible from your side.
Good morning, sir. Is this I am audible now?
Yes, you are audible now. Please share your screen again because we cannot see your screen now.
Okay, sir, no problem. So just a second. Sir, I hope now.
Yes, it is visible now. Please proceed with your presentation and within 5 minutes, I mean till 12, you have to complete it.
Sir, I'm presenting from phone. Actually, laptop से नहीं हो पा रहा है तो
Okay, it's
मैं.
fine. You present. I just have to see the presentation format.
Okay, sir. Sir, good morning, everyone. Myself Neha Patyal, PhD scholar from December batch. So I'm presenting a research paper that I have presented in a conference and prepared for a conference. So title of the research paper is Effectiveness of Sacral Massage on Labor Pain and Satisfaction Among Antenatal Mothers in Active Phase of Labor. So the content which I have prepared my PPT in this order: introduction, then research gap and objective. All these things I have got from the conference guidelines only. Review of literature, methodology, data collection, discussion, conclusion, and references. So the introduction part, massage can be powerful and effective tool for helping women during childbirth. Non-pharmacological pain control methods, which are increasingly becoming widespread in coping with labor pain, that allow women to completely relax and direct them to perceive pain at lowest level. There are many researches that has been conducted, and it is counted as a cost effective and useful for decreasing the pain and anxiety during labor. So next is research gap. The wealth of nation is a wealthy or healthy population. The mother contribution in creating a healthy population is beyond explanation. The massage is not only reduce pain and anxiety, but shortens labor and lower new mothers' risk of experiencing postpartum depression. So let's move on toward objectives. The first objective is to assess the pre-test and post-test scores of labor pain among antenatal mothers in experimental and group control group. to evaluate the effectiveness of sacral massage on labor pain by comparing mean pre-test and post-test scores of experimental group and control group. The last objective is to assess the post-test scores of satisfaction among antenatal mother after sacral massage in experimental group. So the literature review, I have included only two literatures.
Hello.
The first literature was on quasi-experimental study, pre and post-test design, which was conducted in SGT University, Delhi by Sapna Ekojam and Mamta Devi et al. In November 2020. Methodology that they have adopted was population was pregnant women, sample size was 60, 13 each group. Sample technique was purposive, and the technique and tools are pain assessment scales. The result of that study showed that pre-test score is 14.63 plus minus 2.79, and post-test score was increased, that is 5.50.7 plus minus 2.69, having significant difference with t-value of 12.268 at level of significant 0.001. The next review of literature was on quasi-experimental study, pre-test, post-test design in Maharashtra, conducted by Bharti Satish Veljalle et al. In April 2021. Population for that study was primary gravida mother over age of 19 years, with the sample size 60, 13 each group. Sampling technique was purposive, and tool was used structured questionnaire and visual analog scale. The result also depicted that there was statistical significant difference in back massage found in labor pain of primary gravida mother in study group, that is 0.01 level. Let's talk about the methodology of this study. The research approach was quantitative and design was true experimental, and the setting was Triple MCH Hospital Solon. Sample size is sample is antenatal mother in active phase of labor. Sample size was 60, 13 each group. Inclusion criteria was willing to participate and present during the data collection, age between 18 to 35 years without any complication, and mother should not be used oxytocin during labor. The exclusion criteria was the mothers, those who are not present at the time of data collection. Tool used was socio-demographic variables and visual analog scale for their pain, and a cell structure 3-point Likert satisfaction scale was used. With the technique interview, data analysis was descriptive and inferential statistics. So this was the design that we have used in the study. The group was research experimental and control group with 30 sample size, and both the pre-intervention was done in both the group, and treatment was given only for the experimental group, and post-intervention was done for both the groups. So data collection was in experimental group. First of all, we have conducted one interview in which we have conducted or taken socio-demographic variable. Visual analog scale was applied. Addition to providing them with routine midwifery care, we have administered massage to the sacral area under the supervision of midwife and obstetricians also, in the 3 cycles each for 30 minutes. That is, when the cervical dilatation is 5 to 7 centimeter, at that time we have conducted or done the sacral massage. Then between 7 to 8 centimeter dilatation, and then between the 9 to 10 centimeter dilatation, we have done superficial massage for 5 minutes, deep friction for 5 minutes, and effleurage for 5 minutes. The picture shown here shows here the steps and the massage area. Then next we have conducted visual analog scale with that is used Wong and Baker face pain rating scale was applied and evaluated after the massage in active phase. And finally, self-structured satisfaction Likert scale applied and evaluated after delivery. In control group only we have done routine midwifery care. Other than this, rest things was not there in the control group. The result and discussion for analysis, we have used SPSS version 2020. Independent t-test used to compare the mean of highest pain score between
Neha,
experimental.
please come to your conclusion part. I want to
Sure.
see that. Come
Sure,
down
sir.
to the below slide.
Okay, sir. So
The ending
discussions and
slide.
conclusion.
Okay. Can
So
you read out the
recommendation.
conclusion for me
Okay,
this
sir.
time?
Sure,
Just read
sure,
out the
sir.
conclusion.
Sacral massage applied during labor was found effective to reduce the pain and increase the satisfaction, also positively affected the perception of labor and had no fatal side effects. So it should be recommended as a routine care in partial women. So these were the few recommendations that I have
Okay,
included.
okay, Neha. The presentation is completely fine, and I can see the references also. So the other people who have presented who have not included the references, kindly include the references as well in the presentation. The only thing I want to suggest, Neha, that is
Yes, sir.
from the research. You also mentioned to make this research stronger and
Okay,
not
sir.
look like a loose bond. You introduce scientific that how much pressure has to be put during the massage and where are the areas which shall not be touched or massaged during this period, and
Okay,
with the
sir.
progression of the trimestry or the parturition period,
Okay, sir.
or the gestation period, not the pasturation, the gestation period, how the massage has to be changed, and if not changed, what should be there, and the pressure, the position
Okay,
of
sir.
hand, and the threshold pressure, that after this much of decibels or maybe other units,
Okay, sir.
this much pressure
Okay.
shall not be applied. Okay,
Okay,
so
sir.
include
Okay.
all these things to defend much in the research work. Thank you
Okay,
so
sir.
much.
Thank you so
And
much.
also go through the Kashyapa Samhita if possible, because in the ancient Indian literature, Maharishi Kashyap, one of the Saptarishis, has
Yes, sir.
been extensively working or has said to be work upon obstetrics and pediatrics and the pregnancy care.
Okay, sir.
Okay, so
Thank you so
the
much. Okay. Ji, sir.
next one is, yeah, thank you, Neha.
Thank you. Thank you,
Next
sir.
one is Kanika Dhiman, and after Kanika, I will be taking the presentation of Ritu, and after that, we'll continue with the presentation to next week. That is Kirti, Sarita, Varun, Vimal, Swati, Gurpreet, and Rajat. If Kanika Dhiman is there in the presentation, please share your screen. Okay, Ritu, are you there in the meeting?
Yes, sir.
Yeah, you please present, and after that, we'll proceed to the next week because the time limit is over. So, Ritu, please share your screen and start presenting
Okay, sir.
and keep the time limit.
Okay, sir. Good morning, sir, and all my classmates or fellow mates. I'm Ritu Yadav from Department of Law, PhD scholar. I'm going to present my presentation on right to constitutional remedies under Constitution of India. As I'm a student of law, I want to make you aware with the fundamental rights all we have. As we are as we are a citizen of India, and being a human, we have some fundamental rights, but these rights are got security under Indian Constitution through Supreme Court and High Court. As we know, we have six type of fundamental rights, but sometimes authorities the authorities override these rights. So for protecting these rights, our constitution provide two remedies under Indian Constitution, which are given under Article 32 and Article 226. Deal with the power of high courts. Now, what are these remedies are known as? These remedies are known as writs, and the meaning of this writ is it is a formal written order which is issued under a seal in the name of authority and any commanding officer, court, or sovereign. Our Indian Constitution provides Supreme Court and High Court these power to issue writs for the protection of fundamental rights. Um, Article 32 of Indian Constitution gives the right to individual to move to the Supreme Court to seek justice when they feel their right is deprived. And under Article 226, any person move to High Court for getting issue of direction of these rates. But there is a slight difference between these two articles, Article 32 and 226. Article 32 is Article 32 has a very fine division of issuing these writs. And on the other hand, Article 2 to 6 is a wider area under which the High Court can issue these writs. In Indian Constitution, we have five types of writs. That is, one is habeas corpus, second is mandamus, third is certiorari, or we can pronounce it as certiorari, four is prohibition, and fifth is quo warranto. Now let's move with the meaning of these writs. First one is habeas corpus. Now suppose, let's understand this with an example. Let's suppose if a person is detained by any police authority, any person under any authority, that person should be under any authority, then the person or any representative of that person can move to the High Court for personal liberty. And then in that situation, High Court or Supreme Court issue this writ that you have to produce the body and you have a body. This writ is very important for our personal liberty, and this is secured by Article 22 also. No one can detain any person, and Article 21 also provide this protection ki no one can be deprived of any personal liberty. There are many leading judgments on this writ. ADM Jabalpur versus Shivkant Sukla. It was held that writ of habeas corpus cannot be suspended even during the emergency. It means if there is any kind of emergency, financial emergency, state emergency, or national emergency, this writ cannot be suspended. As we know, our fundamental rights got suspension during emergency, but except Article 20 and 21, these two rights cannot be suspended, and these two rights deals with the personal liberty and protection against illegal detention. Then second writ is mandamus. It means we command. This writ is issued for the correct performance of mandatory and purely ministerial duties. It means a higher authority issue this writ to a lower authority in order by saying we command you to perform your duty properly. This writ is a legal right for the applicant if anyone wants to get a performance of his legal duty. A very leading judgment on this writ is Manjula Manjori versus Director of Public Instruction and Gujarat State Financial Corporation. As I have a limit of time, so I'm moving third writ, that is certiorari. Certiorari and prohibition, these two writs are quite similar to each other, but certiorari is a writ which is issued against an order which is conclusive in nature. Means when a court passed a conclusive judgment and any person got aggrieved with that judgment, then he moved to the higher authority. Like if the court of session passed any judgment, he can move for issuance of a certiorari writ to High Court, and if the judgment is passed by the High Court, then the person can move to the Supreme Court. For any conclusive judgment, we can move to the High Court, Supreme Court, any higher authorities that we are aggrieved by a judgment. And on the other hand, under prohibition writ, if your any fundamental right is violated during pendency of your litigation, when your case is under pending trial and your any right is violated by any injunctory order, you can move to the higher authority for issuing this writ. This writ is based on the concept of natural justice. Last one is quo warranto. Quo warranto means what is your authority? This writ is issued by higher court to lower court by asking you performed any duty by what authority, and we are asking you to show us under which power you used this authority. In the case of Baijnath Singh versus State of UP, the holder of an office was continuing in office for a long time and there is no complaint against him. The court refused the writ as it would have been vexatious. So it is well written or by Dr. B.R. Ambedkar was during when the Indian Constitution was framed. Dr. B.R. Ambedkar stated that Article 32 is the soul of Indian Constitution because Article 32 provides the Supreme Court a whole power to protect our fundamental rights. And being a citizen, fundamental rights are the core of our social life. So the protection is very mandatory and it is protected under Article 32 and 2 to 6. That's all from my side. Thank you so much. Thank you, sir.
Okay, thank you so much, Ritu, for keeping up the time limit as well. And I can see the presentation was in scientific manner. The only confusion or a doubt I have that in our scientific community, that is, I'm talking about the biotechnology and other sciences, the red color in the text is not allowed. I think in law it is allowed or not. Please confirm it with your department. Rest, everything was fine with the presentation.
Sir, color, there is no issue of the color because I have presented my presentations during my law degree or LLM. But next time I will keep in mind.
Yes, yes. In the master's degree, it is fine. But for the scientific presentation, I'm using this word scientific, but in
Okay,
your
sir.
department, there would be a different term for terminology for that. So please confirm with the PhD coordinator or your guide that the colors can be used or not, because I think there would be coding according to the color in the law department as it is there in the computer sciences or other
Okay,
departments.
sir.
So
Okay,
that
sir.
would be really helpful to you.
Okay.
And all the other presenting sequences and those who have not presented today, that is from Kirti, Sarita, Varun, Vimal, Swati, Gurpreet, and Rajat. You have mentioned your name in the group, and we'll be carrying forward with you to the next week, maybe Saturday or Sunday, whenever you feel free to present. So keep the time limit as well. And the time for today is over, and people have another class as well, including me. So thank you so much, and we'll see you next week. And all the presenters, please be ready with your presentations in the upcoming week. Thank you all.
Thank
Thank
you.
you, sir.
Thank you so much.
Okay,
Okay,
thank
thank
you.
you.
Have a good day, sir. Nice weekend.
Thank you, and same to you.